Welcome to this presentation on clinical strategies for pain, brought to you by the Philips Learning Center. The 9-part series for clinical strategies, pain, can be found at theonlinelearningcenter.com under the Diseases and Conditions section of the course catalog. This 9-part series by Ashley Davidoff, MD, are designed to give the healthcare professional an overview of pain, describe the diseases that cause pain, how we in general approach the diagnosis of pain, both from the clinical aspect as well as from the imaging perspective, and lastly, the basis for pain therapy. The series take particular body regions or organs and provide a more detailed look at pain. Pain is a common symptom defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is a warning system and feedback mechanism that influences how we adapt to our environment. However, pain at its core is suffering, and its persistence can be vexing to those who help the sick and often at a burdensome cost to society. The causes of pain are innumerable and exist within the full spectrum of human diseases. Clinically, pain is but one consideration in a constellation of symptoms and physical findings. A myriad of processes can occur in response to tissue injury, leading to either irritation of a somatic nerve or distension and pressure on a visceral sensory nerve. Diagnosing pain can be a challenge when its location and pattern are elusive, widespread, recurring, or unremitting. Somatic pain is sharp and well localized. It is caused by direct injury of the skin, pleura, pericardium, peritoneum, muscles, bone, joint, or connective tissues. Acute somatic pain signifies imminent and possibly dangerous bodily injury. Visceral pain is dull, aching, and poorly localized, and can be caused by abnormal stretching of the visceral covering or the wall of an organ. Pain is not a homogeneous experience and manifests in a variety of ways. For instance, pain may be described in terms of its location, its characteristics, colicky, sharp, or dull, its duration, or according to other factors. Acute pain is a vital response to a noxious injury and is rapid in onset, can be severe, but is relatively short-lasting, resolving as the injury heals or is treated. Acute pain can range from a fleeting moment to weeks or months of gradual relief, usually less than 3 months. Chronic pain is that which lasts more than 3 months and/or when pain dwells beyond a realistic healing time. Pain syndromes of the head and neck vary according to the degree and area of injury, but are generally poorly tolerated due to the anatomical confines of these regions. Chest pain receives priority status when described by the presenting patient. It can have many causes that range from life-threatening conditions such as myocardial infarction and aortic dissection to more benign conditions such as indigestion, heartburn, and gastroesophageal reflux, costochondritis, and muscular aches. Excluding direct trauma, abdominal pain is often visceral in nature and therefore difficult to delineate. Visceral pain receptors are stimulated by distension, contraction, inflammation, and ischemia. The pelvis is another highly vascularized area, comprised mostly of the reproductive organs and a multitude of lumbar and sacral nerve plexi. Due to its anatomical proximity to the abdominal viscera, pelvic pain may often reflect an abdominal process. Back pain is significant in its societal frequency, and the impact on the workforce. Although classically back pain is a self-limited manifestation of muscle spasm in response to injury, disorders of the spinal structures and subsequent nerve roots can cause chronic, life-altering pain and disability. The 9-part series for Clinical Strategies, Pain, can be found on the Philips Learning Center under the course category Diseases and Conditions.